Hey guys, it's Simone and Crystal. It's Saturday, April 11th. It's 12:40 p.m. We're going to do another read on the COVID-19 to answer a few of the other questions that you guys had. Um, hey Chris.
Hey, you guys.
Okay, so I know when I posted recently, I think 2 days ago on my Facebook page, I posted that the reading that you did or that we did 3 weeks ago about saying that COVID-19 was going to be in the red blood cells or that it is in the red blood cells. And now there's, you know, the article that came out, the scientific article saying that it is affecting the oxygen level in the red blood cells. And we'll post all of that details and stuff. So when I posted that, a lot of people had specific questions that I wanted to get more in detail with and questions that I forgot to ask you or didn't even think about. So here, let's start off with this one, Chris. So someone wanted to know if O positive or O blood types was exempt from coronavirus or if there's a blood type that's more exempt. So basically, my question is, are certain blood types being more affected? And if so, why? And are there blood types that are not affected at all?
Okay. Sorry, you guys. I'm just also trying to own in. So honestly, it really doesn't matter about the blood type,
Mm-hmm.
really.
So why are people
But
saying?
hold on, I shouldn't say that because there's some type of um thing on it. I think O is a universal
Yeah, I
blood
think
type,
so.
but it's what
Like, but the virus doesn't care that the virus doesn't care that an O positive is universal. So let's see, like virus wise, whatever you come up with.
Okay, so what's happening? It doesn't really matter in general the blood type that you have, but what some doctors and scientists are noticing is activities with blood O.
So they're noticing
Like
a lot of virus in blood O.
it's more visual. Like I could see it more visually. Like O is like telling the story, and other ABs and whatever blood type there is, it's more secretive.
But here's the question that I got. The question that I got, the person was saying that
does it matter
that the virus is not showing in O types. That's what I'm saying. But you're saying that the virus is more in O's?
Yeah, it's more. Hold on, let me just rewind this. It does not matter your blood type. It's showing in every blood. O O is showing more activity than all the other blood types. So yeah, that's what I'm saying.
But why would this person say that O types were exempt? So you're saying, if
No
anything,
one's
no one's
No
exempt,
one's exempt.
but you're saying that O, if anything, O is more not exempt. O is getting more virus. Is that what you're saying?
O is just being shown a light on. I don't know what is being shown a light on. If O is being shown a light on, if no one's seeing anything in O blood, or O is being shed light on if you're seeing activities in the blood. But honestly, it doesn't matter about the blood type, and O, it really doesn't matter.
So the virus is not discriminating against blood.
No, nor gender, nor color, nor creed.
So why would they think O was being exempt if you're seeing O as more? Okay, so what does it do to people with certain like conditions? And I want to do it individually. So I want to see what it does to people with G6PD, diabetes, sickle cell, anemia, cancer, and by it I mean the virus. Like, does it affect these individuals more so than maybe other people if they happen to catch it? And let's start with G6PD. What does it do to people who has G6PD, and does it affect them more than if they didn't?
Okay, so with G6PD, I think I'm saying that right.
Yeah.
I don't know exactly what that is, but from my read, it affects the brain. So I'm gonna say it's swelling the brain, so fluid in the brain. It affects the brain.
Of people with G6PD?
With G6PD, if you get COVID-19, it really does a toll on your brain. So this could lead to people being in coma, vegetables, stuff like that. So you really want to stay clear.
If you have G6PD, so it's going to affect you more so.
Going out and stuff like that. I'm not a doctor, so go talk to your physician, but just my read, in general, if I was me and I had G6PD, I wouldn't put myself in large groups. I would try to order my food online. If I can't order my food online, I take my precautions, wear my mask, wear my
So you're saying if they have this, they're more at risk than someone that doesn't?
Everyone's at risk, but if you have it, it affects your brain and a lot of fluid build up in your body.
Okay. And I also heard that people that have G6PD, like they're not allowed to take certain prescription, including aspirin, certain sulfa drugs, which is like antibiotics, as well as the malaria drugs. I guess, what are their options?
Yeah, a lot of fluid. So if you have this, then your G6PD, some of your symptoms is going to be a lot of fluid, meaning you're going to be coughing a lot of mucus up. You're going to feel very lightheaded because something's happening in the brain, even eye pain. Again, talk to your physician if you're feeling this. Ask them what you can do. If they tell you to go to the emergency room, or if they say monitor it, you have to go on Google and see, hey, how do I clear up mucus? Maybe that's activated charcoal taking that. I don't know. You're going to have to use your discernment and do that. I think it's...
Or Mucinex or something.
Mucinex to dry it out. Not laying on your body. Go in like a fetal, in a doggy position with your knees on the ground and your elbows on the ground.
Oh, really? That helps?
Yeah, for them.
Mm-hmm.
But again, I'm not a doctor, so don't come for me and talk to your physician. Yeah, but there's going to be a lot of mucus, lightheadedness. You have to drink your fluid still.
What about...
Just because you have a lot of fluid in your body, you still have to drink a lot of fluid.
Interesting. What about people that have diabetes? Is that the same effect as if they had G6PD, or how does it affect them in their body?
Oh, let me see. Wow, so I see a lot of puffiness. So they're swelling.
So you see it being different than someone...
It is different, like some symptoms. Mm-hmm. It's more so in the back. Okay, so people with diabetes, is really affecting their lungs. Their lung area. If it's not both, it's one.
Mm-hmm.
So if it's your right lung, you're going to feel some stuff in your left side of your brain, and then also right side of your face. But they're going to be swelling a lot. So you have to get rid of... Again, I'm not a doctor.
Yeah, you don't have to keep saying that.
Yeah, I have to. I'm not going to get charged for this. Try to take out salt out of your dietary plans, because that's swelling it even more. If you have COVID-19, obviously you're going to have to eat and drink still, but please keep your salt minimum. at minimum if you have diabetes and you're showing signs of lung issues, swelling in the face and cheek area, and a hot sensation in your back, like that's like your lung area. Like try to avoid salt as possible so you could like not retain fluid too. And so the swelling could go down, and then also see what your doctor would say to take for swelling.
And
that's for diabetes.
Okay, what about sickle cell? Is sickle cell and anemia, is that the same thing or are they different? Because I always hear it together.
I'm sure it's different.
Okay, so what about?
I'm not really sure what sickle cell. Mm-hmm. Sickle cell has to do. It's like your body aches. It's like a lot of muscle aches. But hold on, let me channel this. So sickle cell is with the stomach. They're having a lot of retention of fluid in the abdomen. If you have COVID-19, what to do for that? Okay, so if you can't lay on your stomach, if you're sickle cell and you're retaining a lot of fluid in your abdomen, you have to sit up, and you're prone to getting blood clot. Yes, sorry. So you have to sit up, and also you have to elevate your legs. You're prone to leg blood clots. Yeah, that's going to be very difficult for the sickle cell people. I think they might be hospitalized.
Oh, wow.
But again, talk to your physician. You have to take fluid, all this thing. But if you're suffering from that, you're best off sitting up and elevating your leg also.
And what about anemia? Anemia, I think that has something to do with the blood. I don't know.
The blood, yeah. Like maybe not a blood loss. I'm not sure what it is. Mm-hmm. I would have to Google it. But anemia, from my channeling, okay, that has to do with their throat. So I'm gonna say it's the jugular vein thing. It's like swelling in the throat area. I don't know if it's a vein or something, but yeah, they have to be very careful. That anemia has to be careful because it's going straight to the heart. I think fluid is getting stuck there. Anemia people, they have to really take it easy. Anemic people, sickle cell people have to really take it easy. Anemia has to really take it easy. I'm trying to see what could they do for this.
So you see fluid going in their hearts? Or in their heart?
But the neck area, but yeah, I think it's going to a major artery. It's like they're going to have a lot of issues breathing, confusion. Like, sorry, I'm channeling. I think you're going to have to do like head motion, that left, turn your head left, turn your head right, turn it, no, you can't turn it forward. Turn it backward, down, up like you're looking to the sun. Turn it left, turn it right, but don't look down to the floor.
Why?
But I don't know why. It's sort of the breathing. Mm-hmm. The breathing is very hard, so maybe looking down on the floor is not good.
Oh, okay.
But yeah, you have to really you have try to avoid like large areas.
What about
if you? Mm-hmm.
You could finish what you're saying about anemia. I have another person. I have another.
If you have a grocery, try to do it online. But if you have to go out, take your precautions.
How about obese people?
Obese, it's like swelling. They could get it. It depends on how the virus comes in. It could be swelling in the lung, abdomen. I see that. Hold on. I see them having retention of fluid again.
The only reason why
So
I
they're.
asked this too is because I saw
Mhm,
like a lot of people that, not a lot, but I saw
mhm,
some people that died and they said that, they didn't have any previous health condition, they were just healthy. But then when you look at some of them, they were obese. So I'm thinking, okay, is that a factor too? Is obesity a factor that
yeah.
that's causing mortality if they get this virus?
Mhm.
Okay.
It is a factor too because of hypertension. I'm not
Oh,
saying that all
hypertension.
obese
Yeah.
people have it, but then also with this virus, it mutates and it likes certain things and it likes salty food, salty
Mm,
things. I'm not saying that all obese people eat salt.
yeah.
I'm pretty obese myself, but I don't know.
Should we
But
all cut down on
there's some,
salt as a whole though? Like all of us?
not necessarily,
Oh,
because some
okay.
people need salt in their diet,
Okay.
and some people need to take that out.
True, true.
You have to be this 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 virus is trying to make people as healthy as possible. Try to be as healthy as possible to your ability.
You know what's
If you
interesting?
think you have too much salt, sorry, yes.
What's interesting though is that how we did another read and it said it doesn't matter whether you're healthy or sick, previous condition, old, young, you could
Mm-hmm.
still have mortality with this. So is it now health is a factor?
No, it's not a factor. Anyone could get it, but it
I mean
depends on
mortality. Like I know anyone could
mortality.
get it. Like
Uh,
could anyone die from it though, even if you're
yeah,
healthy?
anyone could die from it. Anyone could die from it. It depends on the chemical in your body, how it reacts. If it's a fluke, if it's not a fluke, if
So
you have underlying disease, it doesn't matter really.
so I get cutting down your salt if you need to, but what does it matter if like you could still die from this or if it's still gonna kill you? You know what I mean? Like I don't understand why you would do that.
So the thing, what you just fundamentally precautions. That's all it is.
Hmm.
Precautions. What do you think that will help you? If you're taking too much salt, okay, maybe I should cut back on my salt.
Yeah.
Precaution. Shoot, if I have to go outside, I'm not going to show my whole bare face.
Okay.
Precaution. I'm putting on my glasses and my scarf. Precaution. This is all it is. It's not who's going to live, who's going to die.
Yeah.
O going to live, B going to live. No, it's not about that. It's precautions. Taking your information and incorporating it to your best of your ability
Okay.
and praying that you ain't one of them. Because we are lucky if we're not one of them, honestly.
It sounds so
Not,
sad. One of them.
I'm sorry to say that,
It
but
sounds sad. Like dang.
I know, but yeah, just killing people, but it's serious.
Yeah. Let's just.
The little things count.
Hmm.
Don't dismiss something if it's small,
Okay.
because clearly the smallest thing's killing us, and it's COVID-19, and that's a virus, small.
Got it. So obese people could cut down the salt. Some of them, if they're taking too much salt.
Yeah, because it's a lot of swelling. I'm not saying all people with obesity is going to endure swelling, but if
Hmm.
you're obese and you're enduring swelling in your body, maybe you should cut back on that and call your physician and see what they should do. And if they say, "Oh, wait it out, it's just a cold," you as a individual have to take some ownership, meaning take some I don't want to say responsibility, but responsibility and go on Google or call everywhere under the sun or what and say, hey, this is what I'm having, or look online, read a book, and see what to do
How about if
if
you have
no one's going to
cancer?
help.
How about if you have cancer in your body? How does it affect people with cancers in their body? And I'm not going to specify what kind of cancer, because cancer is, regardless of where it's at, it's like a certain mutation with your cells multiplying. So, what does it do to people with any type of cancer in their body?
It's like body ache that they're getting, like very body ache, stiffness in the body. Um, they get they're getting cold, the like temperature, fever. They're getting the fever. They're the
Mm,
one who's getting the fever. So if your body's super hot and stiffness in the neck. Like they're getting, I think the jugular vein. I don't know. Honestly, they're getting muscle aches and they're getting fevers. So if your body is extremely hot, maybe cool it down with a cold bath, cold shower. If your body's extremely cold, cover up, cover in a hypothermia blanket or your heating pad, or put on a lot of clothes. Call your physician.
And someone brought up in one of my comment section, they talked about using like plasma from patients that had the COVID-19 and recovered. How does that work? Is that a good idea? It usually is for other things, for other illnesses that you get. If you recover from it, using your plasma and blood is good.
That's like them trying to find like a vaccine, like, oh, if I use someone who had it, it's like I'm immune. But you could re-get it. It doesn't really matter, the plasma, honestly.
Not okay. So that's not really.
So it's not gonna, yeah.
So people that
they're gonna do research on
so
that,
basically,
but it's not gonna be really
people that had it, they could still get reinfected. So they still need to take all their precautions still, like 6 feet away, mask and stuff.
Yes.
Interesting.
Yes.
That's crazy.
Because you don't. It's crazy because you don't want to go take the test and you come out negative, and then the next day you encounter someone and you get it.
So how could they get it again? Is it the new strain that they're getting is different than the first strain, or is it the same exact strain? How could they get it again if they've recovered from it?
Both. You could get it again through maybe even your house. Yeah, same strain. Maybe in your house it's on one of the surface and you didn't wipe it down properly. Or,
no, and I get that. I'm not talking about how they could get it. I know how they could get it from people. I'm just talking about in the body. Like if your body has already recovered from the same exact thing. Same strain.
You can get again. It's just like cold. You could get a cold again. Yes. That's why. Yes, it shows that. Yes.
But because your body builds.
And then you can also mutate.
Yeah, but with flus and stuff, the reason why we have vaccine is because it's like different strains every year. But your body makes antibiotics for the same strain. So usually if you get it, you wouldn't really get it again if it's the same strain. So with this virus, even if it's the same strain, it could still impact the body, or
yep, it's a virus, yeah.
No, but you know how your body develops antibiotics to fight off the virus. That's why you come through it.
But it doesn't mean that your symptoms will just dissipate or you'll be asymptomatic. No, you could still have the same. Say you got the same strand and it came with diarrhea and cold chills, and you get it again. You could still get the diarrhea and cold chills, or you could just get the diarrhea, or you could just get the cold chills, or you could just get none. It doesn't matter.
So you're saying some people that got over it, they may not get infected back with the same strain, but other people it will still affect?
Yeah, or they could get infected back with the same strain, or it could mutate into a different strain.
So still take precautions. That's interesting. So how do you fight for this if you can't use the blood from previous patients that has overcome it? Like, what could you do besides, scientifically?
Scientifically?
Yeah, what can you do if you can't use these people's strains?
Scientifically done yet, because you have to access your red blood cell to fix that. But
because if you can't use past patients,
just taking precautions. But it has to do with the red blood cell. It's like mutating the red cell.
So, okay, let's talk later on down the road, maybe finding the vaccine or finding a cure. I know it's going to go dormant and then it's going to come back per our other reads. But how do you find a cure for something or vaccine for something if you can't use other people that's been infected as a testimony for it? Like if you can't use your blood or DNA or blood cells, red blood cell as a testimony.
Well, they're not going to take that off limit. They still are going to use that because they need to know that, hey, we could use it or we can't use it. They're still going to test it, and they're testing the people. I don't want to say this is just me doing my little psychic read. I wasn't in the facilities or anything, but they're testing on the patients too who's coming in. They're literally giving them.
Yeah, I know they're testing on it, but I mean, I know they're not going to stop testing on it because of your read. They're probably not listening to the psychic video. I just mean they're going to test on it, and per this, we're saying that that's not going to matter. So how are you going to find the vaccine if the test on the previous people that were affected by it doesn't matter? You know, like how do you find a vaccine for something like that if you can't use the past people as testimony for that?
Exactly, and that's what's different. That's what's going to come out, a whole new technology and a whole new way of looking at things. Maybe you don't necessarily find information with past things or people with the thing. Maybe it's a whole new outlook or different outsider thing.
Okay. And then, let me see. And do you see someone finding it, like the cure or the vaccine for this? And what does that look like?
Not. You want the truth?
Yeah, I just want all the truth.
Not really. No. I see like you know how we have pills. Obviously, we don't cure diabetes and stuff, but we have pills to make it obey, like to make it slow down. Like they could find certain things to slow down so it don't affect the kidney, so it don't affect the lungs, so it don't affect the heart. Yeah. But they don't find it. We did another read. How they find it is through another read that we did. You know, the Atlantean thing.
Yeah.
Is through this formula. Oh, and then it just makes sense.
Okay, got it.
But we do find certain things that help alleviate.
Got it. That makes sense. And when do you see this dying down? So I saw that, you know, Italy, they were about a month ahead of the U.S. with infections and mortality. And I saw that this may change, but I saw that their president, or I don't know if they call it prime minister, that they're going to change. They're going to, like, they extended their stay-at-home order until May 3rd, which then it may be extended even longer, or they may not extend it. But do you see ours maybe going to June 3rd or stay-at-home order, or is it going to be longer than that? Like, when do you see this dying down for us to go outside back or go to work back?
So it's coming real soon where they're going to just say, hey, it's reopened, but listen to this. They're going to say, but we're going to have laws where you can't go to the bars anymore. Mm-hmm. You can't, you know, what they have now. Yeah. You can't be in large settings and stuff. You could still exercise and stuff, just make sure you're not around people.
Yeah.
They're going to tell us this really soon. Like, tell us, okay, everyone can go back to work, but still use your social distance, and after work, go back home.
So it's like what one of our other reads said, you know, some people will still be catching it because whatever, and other people will be asymptomatic, so you won't even notice the difference. But do you see them, okay, after they do that, which is coming up really soon, whenever it's coming, I don't know when that's coming, are they going to have to change that now and say, wait a minute, we're seeing a rise back in mortality or people?
No, this is when they're going to start being secretive. For the government, it's going to start being secretive, not necessarily telling the public now. Now you're going to really have to do your research on getting that information. And that's when you're going to start seeing a lot of boycotting, a lot of stuff like that, rioting, I don't know, protesting.
Because people are still going to be dying and being affected?
And they're like, why do we still have to go to work? I'm not going to work.
Yeah.
Stuff like that, but it will not be in the public anymore. It's just we're going to just have little laws, and the government's going to say, like, your states will have your laws.
Yeah.
Meaning, maybe 8 p.m.
Mm-hmm.
Everyone off the streets. Small gathering, no more than 5 people, something like that. If you don't live in that household,
But you still go to work.
but you still go to work.
Is that their way of trying to like protect the economy so we don't go down?
Protect the economy, protect the public portrayal of what's happening, and protect their country from outsiders. The country from outsider. The country from outsider.
Are they going to lift travel bans? When they tell us we could go back to work, which you said is coming soon?
No travel if you don't have to go via work. Like, very important people who have to travel. So if you're house, whatever, broker, and you need to travel here and there, no. You're going to have to do that online or figure out a way. But, yeah. But that's going to be our new rules. Basically.
I just feel like that's not good. Like, I guess it's not good if the economy is bad, too, because people are going to die either way because they can't feed themselves and, you know, if they can't go to work and stuff like that. It's just like, I guess I want to know which two evils is better. Is it better to send people out when you don't have the virus under control because then they can make money to feed themselves? Or what?
Ideally, what they should have done was every country should just go and shut down. Ideally, everyone should go and shut down and pretend like it's just a day that you wake up and then everything goes back to normal. But what they're doing is, it's like, just pretend it's a freeze, like you froze in time. And then when everything comes back to normal, you go about like that never happened. But that's not what they're doing.
No.
I would like it if they did that. That would be wonderful. But they're not doing that because everyone is not saying us, but like some countries is being sneakier than other. Oh, well, our people are fine, so let me still do the trade and try to pump out money, which isn't right. Chinese Chinese government is saying that, hey, we're back to normal. But hey, the majority of the world's not back to normal. How about you slow it down and wait for other people to get back to normal?
Yeah. But no one's
and again, the Chinese is not really telling the truth on their numbers too.
Yeah.
So
Dr. Fauci estimated that 100,000 people were possibly going to die with doing all the precautions, which would have been like a couple million, but it's only 100,000. Then he said 80,000. Now he says only 60,000, which doesn't sound as badly as 100,000, and it doesn't sound as badly as a million plus. Do you see that only being our death count mortality rates in the U.S., or do you see it being more?
It's definitely more, and they're saying that to not scare the public, and then also to change the narrative. But it is in the millions. That's what he said in the beginning. That was correct.
It's in the millions.
But,
you see,
yeah, but we have to say, hey, we've passed the curve now, and now we're going slowly. It's a narrative they're playing. Hey, see, we hit the peak. Now we're going down and down and down. Like that.
You know what I find interesting is, like when I see Dr. Fauci talk and he's up there, like some of the people that he's up there with, I know they're not as trustworthy, but when I see him, I look at him and I think I'm going to get 100% truth from him. And he has this genuineness about him that I don't think he's going to lie to me. If he says it's 60,000, it's going to be 60,000, God willing, or, if we do what we need to do. But do you see that that's not necessarily the case even with him? Because when I look at him, I think he's a truth teller. He's genuine.
Yes, it's to soothe us, to appease us. And then also you have to remember, maybe he does tell the truth. Maybe now what they're showing him, hey, let's just only show Dr. Fauci these little things that's going down and down. So he could come out and say the truth, tell us this, but no, that's not the case. It's a narrative.
It's just weird. I guess what I'm kind of upset or pissed off about I don't like when stuff feel like it's out my control. And the virus is one thing, but if you know and you stay in the house, that's like I feel like that's within my control to stay in the house. But I don't feel like what's in my control is if the government is going to say open back up the country, and also our governor is going to say open it back up, and now you have all these people going to work or just living life as normal, but nothing is solved because you're still being infected. And I guess I don't know how to like stop that. I don't know what to do to stop that because you can't do that if things isn't fixed, right?
Mm-hmm. Yep, and that just again, this whole thing, COVID-19 has shined or shown a light on things that need to change, and band-aids don't fix wounds.
But how are we going to know that? Like, how are we going to know that if they're not going to be advertising how many deaths anymore? Like, how would you know
you doing
that?
your research. You doing your research. You actually looking at your local hospital tracker things.
Mm-hmm.
I think they have to put it out in the public, or not necessarily on front pages, but
Yeah.
you have to put it somewhere. Like, this is how many people died. You doing your research.
So you're
but then again, remember, sometimes they don't really mark numbers properly. Or you have to remember, some people aren't getting tested positive because we don't have a lot of testing.
Do you see
to say they died from COVID?
I know you talked about like a boycott uproar, but you see that gonna happen because if you're telling me everything's fine and we're all going back to work, but then I hear like everyone, all my friends saying, "Oh, lost another one today, lost someone that I know today." Like at what point as citizens do people get frustrated or fed up and say, okay, too many deaths now and you guys aren't broadcasting this anymore because now I know 20, 30, 40, 50 people that know someone that's died or that know someone that's died. Are people going to be outraged? Because it feels like they're not.
I could give you, well, I could give you a prime example. Well, the Black community know it quite well. Black Lives Matter, all lives matter.
Yeah.
There's going to be an uproar. You can't just sit there. Obviously, something's happening. Something's happening.
Oh,
and there's going to be a light. It's like, yeah, it's like that.
Okay.
If you followed Black Lives Matter, then you'll know.
So here's something.
It takes a while. Then, hey, there's too many dying. Now it's a little suspect. Obviously, people are going to start uproaring.
So they've talked about recently how Black people are being more affected within the United States than many other races. And I know some Black people that think there's a conspiracy behind them now pushing Black people as the face of COVID-19, especially with our read saying no one's exempt. So why are Black people being the face of like you guys are being affected more? Is that a conspiracy or is it because of like underlying health issues or stuff? Or is it also a conspiracy?
Yes and no. Both yes and no. Also, remember, I don't know. I don't want to say I don't know. Black Lives Matter, like, there's not really there is traction there, but it wasn't really nationwide traction. It's like, okay, it's only affecting Black people, so okay, I don't really have to worry that much. It's making it easier. The narrative is easier. It's making it easier for people to go back to work. The non-Black to go back to work. It's making it easier for them.
It's soothing them, but I mean, what
the narrative?
It's not. That's not good for them either. That narrative isn't good for them if they're going back to work and then they're going to be keeling over too, thinking that they're exempt because they're not Black.
Exactly. But then, we want the economy to continue.
What's the non-conspiracy part of that?
The non-conspiracy, yeah. There's a lot of the disproportionate injustice of like maybe the healthcare system. The majority or quite a bit of Blacks don't have the health insurance, or when they say, hey, I have a pain, and they go to the emergency room, you could go do your research. There's articles and stuff about this where they think that, oh, they just want a drug, and they consider them like crackheads or something like that. So, hey, maybe your pain isn't as strong as you're saying.
Yeah.
And you're saying it's a 10, but no, I'm going to say it's a 5, and I'll give you a little bit of thing. There's a lot of things. It's about the systems, the systematic issues that we're having, and then also it's to appease the nation. Yes, the nation's racist and all that, and also there's a class difference.
Oh, okay, so it's all of the above, basically.
Oh yeah, basically.
Did you want to touch base on your list that you had made about all of that stuff? And
yes.
I don't know if you want to do like a background and how you came about this list and stuff.
So right now in the healthcare, I don't know if all doctors will know this, but this is right now for COVID-19. This is the pattern that everyone's seeing right now for COVID-19. So symptoms. So it's abdominal free fluid. So that's a buildup of fluid in the abdominal area. There is a fluid in the bladder, in the urinary tract, so you're holding on to fluid there too, unable to pass your urine. So there's a buildup of fluid. There's a buildup of fluid in the pulmonary area, so that's your lung area. And there's a buildup in the cardiac area, that's the heart area. And there's a lot of buildup, meaning buildup of fluid. And what was interesting is
did you mention the kidney?
Yeah, the kidney too. The kidney.
Is it like buildup of fluid?
A buildup of fluid, but then also it's not filtering the things that needs to be filtered out of the kidney. So it's not filtering out, the gunk.
Yeah.
So that's a problem when it don't filter. So it's a lot of retention to fluid. So some of the symptoms will be fever, swelling, incomplete urination. You want to pee, or you feel like you need to pee, or incontinence. So you're urinating or fecaling on yourself, nausea, vomiting, swelling, headache, all those type of stuff. Your lungs, fluids, mucus. So that's a pattern right now. So definitely we can say that's the pattern for COVID-19. Now, the problem is, well, how do we fix that? And that's what the dilemma for doctors are having.
Because I never hear them mention mucus before either.
But that's like when you're coughing, when you're coughing and spitting up, that's mucus. So that's the fluid in the lungs, wherever it's at, or it could be the fluid in the heart.
Yeah.
And you're coughing it up. That's mucus.
Oh, interesting.
Yeah.
Because now I'm like, do I have this? I'm like, do I have it? Because I'm always like, okay, here's my question. How do people with seasonal allergies differentiate? How do you know that your mucus, that your lack of vision or runny eyes, symptoms that you have when you have allergies regardless? How do you know that's not it? Because I have allergy medication. I take it sporadically, but, my allergies doesn't kill me enough that I feel like I can't miss a couple of days without my allergy medication. So how do you not freak out that this is COVID-19 or this is my allergies? Like, how do I know that my mucus that I'm coughing up, that's not my allergies? How do I know my eyes being like runny or red, that's not?
So good question. So with this thing, the COVID-19, it's a deadly killer because it comes in and pretends like it's the allergy sometimes, and then all of a sudden you're just like 1 minute you're 100, and then the next, like 1 minute you're okay, and then the next you're like not okay, like in that few hours. So to not freak out is, if you're having all of these things, not saying you have COVID, but just think, okay, well, if I did have it, I need to take my precautions. Because if you're lax on your allergy thing, then you'll be lax. Like, oh, no, it's an allergy. I don't need to take this medicine. Or, no, I'll just brush it off and swallow my mucus. Or, no, I won't cough it out. No. Cough it out, take your pills, take your tea, take whatever. You don't want to sleep on it. Never sleep on any symptom that you're having.
That's
even
so
if it's a little minor cold. I know it is, but
especially for people that go through allergy season. Like, for the next 10 months, am I just going to be drinking tea every day, even though I'm not from England and I don't like drinking tea? Is that what I need to do?
Because remember, life has changed. Life has changed.
It's just like one more thing added on to. I mean, it's not like I'm doing anything either way, but it's just one more thing added on to my not doing anything. So just do precautions. I mean,
precautions.
At this point, I feel I don't know because I have allergies, but all your symptoms, I'm like, dang, do I have that?
Exactly.
You're like mucus, and I'm like, oh, I have mucus. You're like, can't breathe. Well, sometimes I feel like I can't breathe.
Some people have back pain, wrist pain, lower abdominal or groin area pain. It's hard time breathing. You gotta take your precautions. Like if they're saying, okay, if you're having a hard time breathing while you're laying on your stomach, or on your back, I know that if COVID-19 is having a hard time breathing on their back, maybe I should lay on my stomach because your lungs more of your lungs is towards your back, so maybe that will help. Or maybe I need to sit up and breathe. Maybe if I cough or sit under a fan and let it help me breathe.
You know what I want to go back to? That's good. But I don't understand why people would think that. I just want to touch on the blood types again. Like, I know it's affecting red blood cells, but I don't understand why doctors or even individual would think some blood types are exempt or more prone to it. Like, I don't get that. Is there like truth to that? Because to me, like, it wouldn't come about if there wasn't truth to it, you know? Like, why are you thinking some are exempt, some blood types are exempt, or some blood types are more prone to it? And since it is affecting red blood cells or blood in general, maybe it does have something to do with the blood types too, you know? And I just want to touch more on base with that because it didn't really clear it up for me when I asked.
It doesn't matter about the blood. It's just like, I don't know how to explain, but it don't matter if you have A, B, C, D, F, G, or whatever blood it does not matter. I think everyone right now in the medical field or whatever field, they're just doing a lot of testing, and they're like, hey, well, nothing happened for this or something happened for this blood type. I'm going to write this down so they could have this in reference, but it doesn't mean that that's not the case.
Okay.
That is the case.
So are you saying we don't have enough data yet?
Yeah, we don't have enough data yet, and the case is it's affecting everyone, meaning everybody in its blood.
Okay. That's
the problem is, okay, this is the real issue. You don't want to tell one person, hey, don't worry about it because you have when that's not the case. And then it's like it's telling someone it's okay, sleep, it don't affect you, but come to find out it's at their door and they weren't prepared.
Exactly. That's what I'm like, why would someone put a research out that it doesn't affect O blood or that it doesn't affect whoever? Like, because then I'm like, oh, good, I'm exempt because I have O blood. I'm exempt.
Yeah, and then you also have to do your discernment. You have to remember, they want to open the world up back. They want to open the economy back. You have to remember. So they're going to pump out Harvard people or whatever. They're going to pump out these big top people saying it's okay, it's okay, it's okay. Yeah. You as an individual take your damn discernment and say, okay, just because 20 people said it's okay don't mean it's okay.
Okay. And still look around.
Or maybe it does mean it's okay.
Or still look around.
If you think it's okay,
what's going on in your environment to see, wait, they're saying it's okay, but then I hear all my Facebook friends saying they lost 10 more people or something. God forbid.
So what do you do? How about you go in between the lines, or you find a good great area for you to sit. Like to do it.
Yeah. I think that's good.
Yeah. Just remember, nothing's okay until you get a cure.
Mhm.
Or you know what? We've been living without a cure for AIDS too. How did we navigate through that?
You know what I want to bring up real quick before we close the video?
Yeah.
There's a lot of people now that were talking shit about the COVID-19. And I mean, not like about the COVID-19, but they were saying, oh, it's fake, it's a conspiracy theory, it's nothing's gonna happen. And then let's say they wrote this March 14th or whatever. And then 2 weeks down the line now, at the end of March, or now you see that there's an obituary for them, or you hear doctors, like there's one from Dr. Drew. He's like a TV doctor. I don't know if he's a real doctor or not, but and he was saying this is fake news, this is like hysteria. And then come to find out, like last week, he's saying, you know what, my initial thoughts on it were wrong. Now I realize the seriousness of the coronavirus. So I hear a lot of stories of people like that. I don't know if I had a question. I don't know if I had a question.
No, you just want me to just like elaborate on that. How do I feel about that?
Yeah, if you want.
Well, yeah, I saw certain stuff like that too. Just me in general, I don't like to have a stance on anything that I'm not 100% fully knowledgeable about. And even if I'm 100% knowledgeable about, I don't like to vocalize it due to the fact that if it's wrong, then you look dumb.
Yeah.
And if it's as serious as I was downplaying it, I would feel extremely bad because I have followers, or there's people reading this thing that they're putting out, and now they've made a few bit of people think the way they thought.
Yeah, and maybe not take their precautions that they needed to.
Yeah. It's like, no, that's like basically murder.
Yeah, I guess Trump was doing it too in the beginning too. Yeah.
Yeah, and sometimes sometimes I'm like, I don't know if I want to put this out or not, but whatever. Take your discernment. Don't follow everyone. Just because someone has a title don't mean they're right.
Yeah.
And you have to remember that.
Or it's kiki funny now until it happens to you or someone you know.
Yeah.
Now, and I guess what I hate about people,
me off, honestly.
It pisses me off. And what I hate about people like that, like there's a couple on my Facebook actually. Not that I'm gonna call out any name, but what I hate about people like that is that they're kikiing, oh no, it's not real. Yep. You guys are taking it too seriously. And then I saw at least 2 of them. This happened to them. Not that anyone died for those individuals. But now they're like, oh my gosh, now I'm worried, or now this and this is happening to people that I know, and I'm worried. And I'm like, you were the one like a week ago that was thinking it was so funny or that it wasn't serious, and now you're worried.
Yeah, I hate that. I really hate that because
I can't take people like that seriously. Now you want me to be sympathetic to your, because you were, I don't know, not sympathetic, but like believe your wolf crying.
Me personally, if I find out that someone was like that, nonchalant about it, and then, since it hit home for them, then they're like, oh, I'm sympathetic now, I really don't want to be friends with that person. Because I'm like, wow, you didn't have your discernment or empathy
for anyone.
Sympathy.
It pisses me off because it's like you don't care about anyone else's suffering until it hits home for you. Then you want me and everyone else to care about your suffering because maybe it's not real because it's happening to you. Like they don't understand until it hits home, and I hate people like that.
Yeah, I hate that too, and I hope they definitely change and never make a stance like that.
But I think that's good.
Yeah, you guys, basically what this was saying, I don't know if it will help, but use your discernment, and honestly, just again, this video or audio is just to let you guys know, just take your precautions, and if you are having any symptoms or any unwellness, take your precautions, call for help, call your physician, call a friend, do a research, see what I can do if you're having any symptoms. You know, everyone's capable of being a team player in this. So if you're having a runny nose, maybe you stay inside for a while before you interact with other people, because it could affect other people.
Yep.
Or if you have a runny nose, take some tea. Do a heat a heat thing. Where you open up your sinuses and stuff. Do a treatment, stuff like that. It's all about learning and putting things into actions and just taking what you need to take in and then using it for your well-being. That's it.
All right. Bye, guys.
Bye. Bye, you guys. Be safe.